Good morning, ladies and gentlemen. I'm Arthur Brooks, president of the American Enterprise Institute, and I'm delighted to welcome all of you to this morning's event. It's an address by Senator Rob Portman from Ohio entitled Constructive Conservatism, a bottom-up approach to tackling poverty. Now, you're hearing more and more Republicans talking about the subject of poverty. Why is that? The answer is because our country is leaving the poor behind. It's simply an unassailable fact that the poor, particularly over the past half decade, have been left behind by the federal government and many governments at the state and local levels as well. When the number of people on food stamps has gone from 32 to 48 million just over the past 5 years, when 1 in 6 Americans is so poor as to have to turn to the government for food aid for his or her family and him or herself, we have a crisis on our hands, and quite simply and quite bluntly, social justice is not being served. Somebody has to fight for these people, and we're going to hear today from a man who wants to be in the fight and wants his party to be in the fight. That's Senator Rob Portman, who has as much experience at all levels of government as anybody I've ever met. He has been the senator from Ohio since January of 2011. Before that, he was the U.S. Trade Representative. Before that, he was the Director of the Office of Management and Budget. Before that, he spent many years as a congressman. He knows what he's doing, he can get things done, and he's ready to fight for the poor. Senator Rob Portman.
Arthur, thank you very much, and I appreciate being at AEI again. I was thinking about it as I walked in the last time I gave a speech here. It was about economic growth, and it was about sort of our Republican approach to pro-jobs legislation on the economic and fiscal front, and that's where most of you have seen me, including some of my friends here from the media. But Arthur's right. Today I want to talk about something a little different, and it's about poverty, and it's about some approaches to poverty that we know work, and encouraging my party and those of us who are concerned about the direction of our country to get more engaged and involved in those issues. Arthur has been for a long time. I appreciate him, and I appreciate so many scholars here at AEI who have focused on this issue. When you decide to talk about poverty, it's a little bit dangerous. You've probably seen that with other Republicans who have touched on it, but it's also incredibly important. It's also a little dangerous just because there's so many great minds who have done it. Arthur being one, but also last time I gave a talk here, again, it was on the economic issues, but sitting next to me was James Q. Wilson, one of the people who I've looked up to in this field over the years. Charles Murray, also, as you all know, has written a renowned book on this topic and books on this topic. So it's a tall order to talk about poverty in the midst of some of these great leaders, and there are others at AEI, again, who are focused on it. And it may disappoint some of you in the room, but we're not going to solve the problem today. We are going to talk about it and, again, talk about some alternatives. I think what you'll go away with, I hope, is a little different perspective on it, maybe some new ideas on how we can address really what is the central challenge of our time, and that's restoring this notion in America that we do have a promise of opportunity, resurrecting this principle that every American should be able to rise as far as their God-given talents and their work ethic can take them, regardless of who they are, regardless of their name or their zip code. 50 years ago, Lyndon Johnson went before the American people and said he was ready to take our country to war. It wasn't a war that you might expect. It was to be unlike any in our history because it wasn't against a foreign enemy. It didn't involve guns and bombs. It was to be a war on poverty. And today being the year, this year being the 50th anniversary, there's been a lot of discussion about poverty, and one reason that I wanted to give this talk. This war was to be bringing the full power of the federal government against the problem of children going hungry, people living in hopelessness and despair. And he said we would beat poverty, just as we had defeated other enemies to our country. And yet, 50 years later, there's a sense among many, even some on the left, that the war on poverty has been lost. And no wonder. We see proof of that failure in the 47 million Americans who are living in poverty today, here in the richest country in the world. Even though, according to some measures, we have now spent over $15 trillion on poverty reduction programs over the 5 decades since the war on poverty was launched. In fact, according to one report, so-called deep poverty, those making less than 50% of the poverty line, has recently reached its highest level on record, 6.6%, or more than 20 million Americans. We hear a lot about the growing income inequality gap these days, but we don't hear as much about what's driving it. Yes, the rich are getting richer, but the real problem is that the middle class is shrinking, along with their paychecks, and too few people are rising out of poverty, being able to start their own businesses, get decent jobs, live their dreams. The income gap gets the headlines, but it's the opportunity gap. It's the lack of upward mobility that should concern us the most. Arthur's actually written about this some, and there's one statistic that he's used that I found particularly striking. His statistic is of those people who were poor in 1980, who were in the bottom quintile when it comes to income, 21% of them had risen to the middle class by 1990, a decade later. But those who started off in the bottom quintile in 1995, they only had a 15% chance of reaching the middle class by 2005. So in less than a single generation, we suffered a 1/3 decline in income mobility. And if you looked at it today, particularly given how many people have dropped out of the workforce, as you know, the labor force participation rate is how we measure that. They say it goes back to the Carter administration. For men only, by the way, it goes back to the 1940s when we started keeping track of these statistics. If you looked at it today, I believe these statistics would be worse. The American dream used to be about creating a better life for our kids and our grandkids. That was a dream that brought so many of your families and some of you to this great country. It's what brought the Portman family to these shores about a century ago. But today, for millions of Americans, that seems like a faraway dream. In fact, new data shows that most Americans now believe their children won't be better off than they are. This is not typical in America. We've always believed that the next generation will have more opportunity. But there's some good reasons for it. The middle class has shrunk. It's shrinking. Many people who were able to climb out of poverty in the last few decades find themselves falling back into it. So many Americans are losing ground and losing hope. So turning that tide is going to take a lot of work. It's going to take more than minimum wage increases. It's going to take more than looking at the number of people who are long-term unemployed and extending their benefits. It's going to take more than good speeches about hope and change. Those of us in this room, I think, have some pretty good ideas of where we should start in this discussion. First, we need to create the environment where business and jobs will grow again. And I mentioned earlier that the last speech I gave here was about economic growth and some of these ideas. In an increasingly competitive global economy, I think we need to urgently move on these institutions of our economy to ensure that America doesn't fall behind. I think this requires structural reform, overhauling all of the basic institutions of our economy, including the tax code, trade policies, the regulatory framework, the healthcare system, energy policy, and certainly our broken education system that's failing so many poor neighborhoods. It's actually something that is all here in the Jobs for America plan. I put this together over the last several months. Every Republican has signed on to it, all 45 Republican senators. It's about how we must indeed do what John F. Kennedy once talked about when he said, "A rising tide lifts all boats." I think these kind of pro-growth reforms will create that tide and will create opportunity for all Americans. We need to do these things and more. But I think we also have to understand that while they are necessary, they are not sufficient. Even in good economic times, people are going to be falling through the cracks. Someone who's in the clutches of drug addiction, who's been in and out of prison, who's dropped out of school and has no real skills, you can create all the jobs in the world, and it's not going to help that person. We can get this economy moving again. We can see the stock market go to record levels, as apparently it did yesterday. We can see unemployment rate drop, but too many people will still be left behind. That rising tide we talked about, unfortunately, too many boats get stranded on the shoals. That's why, in addition to our important work to get the economy moving again, we can't forget about those left behind. So today, I want to offer a few thoughts and approaches to the problem of persistent poverty that are achievable, even in a divided Washington, even with an administration that sometimes seems more interested in talking about these problems than in doing something about them. President George W. Bush rightly talked about compassionate conservatism. I call the approach we'll outline today constructive conservatism. In the face of the growing sense that the typical top-down, Washington-based anti-poverty program is not working, too many conservatives, too many in my own party, avoid talking about poverty at all and how to address it. But we can't be a great country if we don't act to help the least fortunate among us. And we can't be a great party if we don't lead on this issue. So instead of abdicating the field, we should be applying conservative principles to the problems of our day in a pragmatic, common sense, constructive way, tackling issues from the bottom up rather than the top down, applying proven methods that have worked before and will work again. There are several key elements in such a constructive, conservative approach at the federal level, in my view. Those would certainly include using the best research available and insisting on evidence-based programs, best practices, taking what works around the country and spreading those practices to all communities, leveraging federal dollars, using short-term federal matching funds to leverage more support and more buy-in locally, outcome analysis, simply put, being sure that we are measuring performance and that it is required to report on that performance measurement. We know these tools work, but we are not using them in an effective way to help those in the most vulnerable communities, the most vulnerable neighborhoods. We tend to talk about poverty sometimes in broad strokes. We rightly focus on the breakdown of the family, the failure of social institutions, of a growing divide in America. My view is that reversing the breakdown of the family, reinforcing the American work ethic that has resulted in much of the prosperity we enjoy, creating a society that strives for opportunity and rejects dependency, that's important, and it's the hard work of generations. And yet, there are issues that undermine families, that cause that breakdown, that stymie the work ethic, that create dependency and despondency, that we can address today, and that I know would make a big difference because I've seen it. Things like drug addiction, shockingly high rates of recidivism, people in the revolving door of prison, and a lack of resources and support for vulnerable children who inherit poverty and are at risk because of it. These problems don't get the headlines, but their impact is, although hard to measure, incredibly important, and these issues are crying out for redress. There's a striking statistic that we hear often that I believe helps illustrate why these issues are so pressing. We know that when kids finish high school, get a full-time job, and wait until they are married, until they have children, only 2% end up in poverty. Only 2%. That's a great statistic. But tell that to a child whose father is in jail, has a mother who struggles with addiction, has no reason to believe that the future holds anything for him but more of the same. There's another much more sobering statistic. Kids who grow up poor are 90% more likely than children who've never been in poverty to enter their 20s without completing high school. They are 4 times more likely to give birth outside of marriage during their teenage years. Families and communities broken by drug abuse, repeat incarceration, and lack of hope or opportunity are increasingly what does drive poverty. I'm not an academic, but I've spent some 20 years addressing these issues on the ground, crafting evidence-based legislative solutions founded on what actually works and what hasn't worked in our communities and in our states. I've learned a lot from these efforts, a learning process that really started with getting involved in the issue of drug abuse. Poverty and drug abuse are topics we often talk about separately to different groups and with different priorities. I've been guilty of that. And yet, they are intimately tied together. We know, of course, that drug abuse and drug addiction bedevils communities, rich and poor, and a big house and a nice car does not make one immune to drug abuse. But, as we all know, drug abuse is particularly devastating to communities that are already vulnerable, where unemployment rates are high, where people don't have the skills or the training they need to get a good job, whether it's the poor Appalachian counties in southern Ohio that have been devastated by the prescription drug epidemic, or the poor neighborhoods in inner cities that are now reeling from the surge in heroin and overdoses and in violence, the gangs and the crime that builds up around the drug trade. You can't talk about poverty without talking about addiction. And addiction is something that a war on drugs is never going to solve. Michael McGrath, who's Cleveland's chief of police, recently came to a roundtable discussion I organized in inner city Cleveland. Chief McGrath was a young officer when cocaine first hit the streets in the 1980s. So 30 years later, Chief McGrath is returning to the same homes to arrest the same convicts' children for the same crimes. And now their kids are being left without fathers. The odds against them from the beginning, the cycle of poverty starting all over again. Fortunately, after more than $1 trillion spent in the war on drugs and thousands of lives lost, we are starting to understand that arrest, prosecution, and incarceration are not enough. Instead, we have to start where addiction starts and end where addiction ends. It starts in our communities. In 1996, when I was just starting out in Congress, one of my constituents came to see me. She told me a story about her son, Jeff Gardner. Jeff had just died of an overdose of huffing gasoline and smoking marijuana. He was 16 years old. His mother came to town for an anti-drug conference, actually, to get a gold bracelet from an ID bracelet from, to give one to President Clinton and to give one to her congressman, me. And she came to town because she wanted to make sure that her son's death had not been in vain, that she could do something to bring more focus on this issue of drug abuse. She came to me to say, what are you doing about it? And I was prepared. I had done my research, so she came into my office and sat down and said, what are you doing to help me? I'm having a tough time getting my school to get engaged in this. They're in denial. My church doesn't want to get involved. I live in a mobile home community. I called a meeting, nobody came. What are you doing to help me? And I said, I have the answer. $15 billion a year is being spent on the drug war right now, on incarcerating folks, on prosecuting folks, on interdicting drugs that come into our country, on eradicating drugs in countries like Colombia. And she just kind of looked at me and said, how does that affect me? How does that help not just my son who died, but his younger brother, who's now facing some of these same pressures? So it got me to thinking. I couldn't answer her question. I did some research, talked to a lot of experts, tried to find out what was working and what wasn't working. Based on everything I learned, I ended up joining with community leaders in my hometown of Cincinnati, and we founded what was called the Coalition for a Drug-Free Greater Cincinnati. I chaired that effort for its first 9 years. It's still an effective organization back home. It's a broad grassroots coalition that brings all sectors of the community together. It's built to address the needs of our neighborhoods, not again with a top-down approach from Washington, but with an evidence and research-based one influenced by what we're actually seeing on the ground, focused on prevention, awareness, education. Because of the success I saw in Cincinnati with our coalition, in 1997 I authored what's called the Drug-Free Communities Act. The results have been beyond anything I could have imagined at the time. There are now similar coalitions operating all across the country. In fact, the Drug-Free Communities Act has sponsored over 2,000 of these coalitions in pretty much every major community in America. To give you some idea of their impact, in the communities where these coalitions are operating, use of alcohol and marijuana and other drugs have declined significantly at all grade levels, with middle school alcohol use down 20%, marijuana use down 23%, for instance, focused on kids. These coalitions are successful because they are a community asset and a community institution, not a government one. They reduce access and availability to drugs, raise awareness about consequences of abuse, and build skills in youth and parents, teachers, communities to deal with the drug of the moment. One of their greatest strengths, I think, is the way they build partnerships within the community to change attitudes and change social norms, and because of that, they're well situated to respond to whatever the emerging drug trends are, whatever the danger is, whether it's heroin, as it is increasingly in my home state of Ohio now, where we have more deaths from heroin overdose than we have auto accidents, or whether it's prescription drug abuse or synthetic drugs. There's a lot of discussion in Washington about how to do a better job when it comes to treating drug addiction. Treatment's difficult, it's expensive, and the success rate is relatively low. That's why we need new, innovative, science-based strategies to treat the disease of addiction. And the place we are seeing those kinds of innovative approaches develop is not here in Washington, but is in our communities. We held a conference here in Washington a couple of weeks ago where we brought experts in from all over the country, over 200 experts, to talk about some of these innovative new ideas. For instance, in Ohio, we have several pilot programs of an exciting new medication-assisted treatment that could be a game changer for recovery. Washington is ill-equipped to respond to what's happening on the ground. That's why sometimes we call states the laboratories of democracy. These coalitions and the other nonprofits are now the laboratory of drug addiction treatment. They're in the field, getting their hands dirty. They're seeing what works and what doesn't work. So when we're thinking about policy solutions here, we need to be looking out there to see what's working. One area where we are doing that and where we have seen the most progress on addiction treatment is in reentry for those leaving the criminal justice system and returning home. Drug abuse starts in our communities, as we've said, but it often ends in prison. As many as 85% of people who go through the criminal justice system struggle with drug and alcohol abuse and addiction. I first got involved in this issue when I saw a figure from the Federal Bureau saying that 80 to 85% of those who had been arrested for a federal crime were high on drugs or alcohol. Prisons, unfortunately, are crowded these days, record numbers. And 95% of people who are in jail or prison, of course, are going to be released one day. According to the Bureau of Justice Statistics, more than 2/3 of those newly released inmates are reincarcerated within 3 years because we're never dealing with the problem that got them into the criminal justice system in the first place. Think about that. 2/3 of people back in the system within 2 or 3 years. When people are in and out of prison, it means more crimes, more fathers and mothers who are not in their kids' lives, more broken families, and since families are at the heart of any community, more broken communities and more poverty as well. We have to get serious about rehabilitation if we want to change that, and we can do so with a little constructive conservatism by supporting evidence-based programs that address the needs of newly released inmates in areas like job skills, substance abuse, mental health, housing, and family support. We know that properly designed prisoner reentry programs can work, and work well. A decade ago, I authored what's called the Second Chance Act, and since its enactment in 2009, this act has supported over 300 local, tribal, and state agencies, nonprofits, and faith-based organizations working to help transition inmates back into their communities with the help they need to stay out of prison. Like the Drug-Free Communities Act, we followed the principles of constructive conservatism, evidence-based best practices, leverage, outcome analysis. The data shows this investment is now paying off. States like my home state of Ohio have embraced the Second Chance Act, used it aggressively, and they've seen significant decreases in recidivism. In Ohio and Texas, recidivism has fallen 11%. It's down 15% in Kansas, and a remarkable 18% in Michigan, saving taxpayers, by the way, millions and millions of dollars. I'm now working on a bipartisan basis to reauthorize the Second Chance Act with an even more effective bottom-up approach, learning from our experience on the ground about what works and what hasn't worked. But we can't stop there. I want to take what we have learned from the Second Chance and apply it directly to the federal prison system. New legislation I've introduced with Senator Sheldon Whitehouse, the Recidivism Reduction in Public Safety Act, will implement the same proven evidence-based methods in justice reinvestment and reentry, but in the federal prison system. That legislation, by the way, has already been reported out of the Judiciary Committee. It was a 15-2 vote, and it was bipartisan on both sides. In fact, of the two who opposed it, one was a Democrat and one was a Republican. The Bureau of Prisons spends nearly $7 billion each year, and each inmate in federal prison costs taxpayers around $30,000 a year. Reductions in the recidivism rate will save taxpayers hundreds of millions of dollars over the next decade. But the true fruit of our effort will be the thousands of men and women who we can save from the downward spiral of drugs and repeated incarceration, who will instead come to know the dignity and self-respect that comes with getting a job and taking care of their family. This is an area where we could use an assist from the President. President Obama recently announced that he would grant clemency to thousands of nonviolent drug offenders. That may be within his power, but it's like placing a Band-Aid on a deep wound. It may cover up the problem of prison overcrowding today, but it doesn't address the deeper problem that drives recidivism. So instead of taking the easy path of executive action, I would ask the President to come to Congress and work with us to pass our legislation to reform federal prisons, leveraging our criminal justice system to incentivize long-term solutions based on what we know works, both to get people out of prison, but also to keep them from going back to prison. Things like diversion programs and drug courts, job training, treatment for addiction, and mental health. We also cannot forget about the vulnerable kids who are growing up in difficult situations today, particularly when it comes to the horrible crime of sex trafficking. Trafficking is both a result of poverty and a driver of poverty. It not only leads to material deprivation, but deprivation of the soul And it's not just a problem in other countries. We've heard a lot about Nigeria recently and the horrific activities there. It's also something we're seeing right here today in America. The U.S. Department of Justice, in fact, has recently said that approximately 300,000 American children are at risk of being trafficked and exploited, and this exploitation often involves trapping these young people through drug addiction. So again, a connection back to the drug issue. This is a crime that preys on children who are made vulnerable by situations outside of their control. Research shows many of these kids have been abused, involved in foster care. Parents are absent, incarcerated, or drug addicted. And here, too, there's a role for the federal government. We have a need today to bring to scale best practices that are working in our communities to reach vulnerable kids before they are exploited. It'll take a hands-on approach by everyone. It takes federal funding streams used to leverage community buy-in. It'll take government systems partnering with victim services. It'll take solutions that can't be crafted in Washington alone, but Washington has a role to play. I've worked with a number of my colleagues on both sides of the aisle in the Senate since I founded the Senate Caucus to End Human Trafficking with Richard Blumenthal. And I now have a bill that passed the Senate Finance Committee with Senator Ron Wyden called the Child Sex Trafficking Data and Response Act. This bill ensures that agencies that receive federal dollars treat kids who are sex trafficked like victims, not like criminals. It also increases coordination between agencies and holds child welfare agencies accountable for providing better data that's desperately needed on the number of kids being sex trafficked so we can get a handle on the scale and the contours of this problem. We all hope for a day when no children are abused or exploited. But until we get there, we need to make sure that the victims of these crimes get the treatment they need while ensuring the federal government does more to identify and incentivize evidence-based methods and best practices in this area. Help people break the grip of addiction. Help them leave prison behind and get the skills they need to work a job they can be proud of. Help them build a better life for themselves, for their families, and for their communities. Help the most vulnerable young people among us. You can do that, and we can make a real difference in the lives of millions of Americans who are trapped in poverty. And yet, while Washington has an important role to play and can use its resources more wisely, as we've discussed today, we also need to realize that government can't solve the problem of poverty on its own. When he launched the war on poverty, Lyndon Johnson said something prophetic that those of us in this room and around this city would do well to remember. He said, "For the war against poverty will not be won here in Washington. It will be won in the field, in every private home, in every public office, from the courthouse to the White House." And he was right. But Washington strayed from that approach over the next 5 decades. We must get back there. Constructive conservatism understands both the key role the national government can play in addressing persistent poverty and the limitations of a top-down approach. It's time to put ourselves back on a path where community institutions and community leadership is our foundation, where government is in support of approaches that work, not dictating solutions from above. Every step we take down that path from here, every success we have, we're not just saving people from poverty, but restoring the hopes and dreams of millions today and millions more yet unborn. That's certainly something worth fighting for. Thank you all.
Senator has a few minutes that he can spend on Q&A, and so we'll do that until he has to run back to the Hill. And what we'd like to do is we have microphones that are waiting around. If you could put your hand up, I'll call on you. If you could follow the basic rules of stating your name so that we can hear you, who you're affiliated with, and putting your protest in the form of a question, that'd be great. So where do we want to start? Right here. Josh Good from AEI. Mike's right behind you.
So another AEI scholar, Michael Novak, said one time that the way we fight poverty is a bit like feeding the horses by feeding the sparrows. And I wonder if you might comment, Senator, on the sort of poverty industrial complex here with respect to what you said about community associations rather than federal contractors or sort of local Washington approaches alone.
Yeah, first of all, thanks for your good work too, Josh. I think, as I said, in the 5 decades since the war on poverty began, it's gotten off track. And it's created a lot of interests, including a lot of big bureaucracies and, a lot of folks who are wed to certain government approaches from Washington. And look, there's some programs that work well and some that don't. We should take a microscope to it and figure out through better oversight what's working, what's not working. But we also have to try some new approaches. And also, the point I was trying to make here today is get to some of the underlying causes. I'm not suggesting that drug addiction and prisoner reentry, sex trafficking are the only issues. There are others as well. But sometimes I think the folks who are involved in fighting poverty are fighting the symptom and not getting at the cause. And one of the causes, again, that I talked about today, is connection between reentry and addiction. We've actually seen some good results on. And so let's encourage more of that for relatively small amounts of federal dollars. We're actually saving a lot of money, a lot of taxpayer money, and more importantly, saving a lot of lives and hopes and dreams, as I said. So I think there's a renewed interest given the 50-year anniversary. I think there is a sense, as I said earlier, even among the left, we can't say we've succeeded. And it's time to try some new approaches. And I like the idea of this constructive conservative approach where we're really forcing sort of the discipline of a lot of stuff that you do and others of evidence-based best practices, performance measures, and relying on communities to help heal themselves with that federal guidance and help. One of the things that we do with regard to Second Chance that I like is we have a website up that says what works. And it's a really simple way to say to a task force, say in Ohio, we have 88 counties. We had a handful of task forces involved in reentry until the legislation. Now I think we have 60-some counties with task forces. So you're in a task force in a small rural county in Ohio. You're trying to figure out what should we be doing about our jail system and the prisoners who are coming back to our county. You can go on this website and see what's working all around the country. And yeah, federal taxpayers paid for that, but it's returning huge dividends because just by having that recidivism rate go down by 5%, 10%, 15%, you're saving enormous amounts of money. I told Arthur there's a program in Dayton, Ohio, in Montgomery County that's been very successful, and they're looking at recidivism in new ways. It's because a judge and a county commissioner both got engaged and involved. They have some data that is really interesting, 9% recidivism. So we talked about the fact that over half of people are getting back into the system. And so it's using some of these best practices helped by the federal level.
Senator, it's not uncontroversial on your side of the political aisle to talk about the safety net for the poor. I know you've encountered some resistance to the very concept, real hostility to the concept of a federal safety net in cases of poverty. How do you deal with that, and how do you think the Republican Party should move forward?
Well, look, I think, as I mentioned to Arthur earlier, one reason I wanted to give this talk is because there's a renewed interest in the in persistent poverty because of the 50th anniversary and the sense of what's worked and what hasn't worked. But I think some of my colleagues on my side of the aisle need to understand that there are evidence-based, again, best practices, solutions that do work. And rather than have a knee-jerk reaction that, this is not a federal role and that there's a way to block grant and a way to push this back to the states and local communities without support is not going to be successful ultimately, in my view. And again, on the other hand, we've got these models of success. Let's build on them. I'm not suggesting, again, that what I talked about today is the only answer. It's part of the answer. But I do think we should not have this reflexive approach from the right that just says, this is not something the federal government can deal with. In fact, the federal government is exclusively able to pull together this research, to be able to find the best practices, to be able to leverage, again, that federal dollar to incentivize programs and practices that actually work. And I think it's a national problem. I mentioned the addiction problem in Ohio. Unfortunately, that's true in most of our states now. And the heroin addiction problem is following, as you know, on the heels of the prescription drug addiction problem, heroin being less expensive, but an opiate high. This is a national problem. You think about, other issues that we address that as I said earlier, I'm leading the parade on this stuff, and it's very important, very important. you know, we do have a national problem with regard to how our healthcare system works and how our tax system doesn't work, and our trade policy and other things. We also have a national interest in dealing with these issues that are driving more poverty and more hopelessness.
Let's go right here. Thomas.
Thanks, Senator. I'm originally from Mahoning County, Ohio, so
Excellent.
an area affected very much by the
Which,
heroin.
which county?
Mahoning?
Yeah.
So Youngstown?
Yeah.
So thank you very much for your work on drug addiction and recovery and abuse. I just wanted to know your thoughts a little bit on marijuana, decriminalization, legalization, both from a ability to focus on heroin, prescription drugs, other issues, and then also in terms of ending that cycle of poverty with recidivism and the other issues that go along with marijuana incarceration.
Mm-hmm. Well, I mentioned a little bit about President Obama's executive action, unilateral action with regard to prison. And, you know, I am for prison reform. I do believe that, as I said earlier, the war on drugs, prosecution, incarceration has not been effective. Having said that, I also have concerns as someone who's been involved in prevention for 20 years about the message being sent of legalization. So there's a difference in my view between the way the criminal justice system handles drug abuse generally and legalization. And so as a practical matter for young people looking at this issue, which has been a lot of our focus with the coalitions around the country, there's an agreement among the experts in the field that the notion of social disapproval is extremely important. I think it's more important, by the way, is what your parents think, which might shock you as a parent, but it matters what you think, and that's why parental involvement is so important in sending that message. So I worry about the message that's being sent with legalization. And I think we shouldn't throw in the towel because we haven't done what we know works, which is more prevention, more awareness, dealing with treatment, dealing with recovery. So there's also this research out there that talks about, you know, drugs being gateway drugs to other drugs. Some argue about that, I know. But I think, again, before we go down this path of legalizing certain drugs and deciding how we're going to regulate it, let's try what we know works. And that's much more on the education, prevention, treatment, which is obviously the most cost-effective way to deal with it. And for those who find themselves in the spiral of addiction, coming up in more innovative ways. I said there's a lot of new medical assistance that's out there that is really interesting. Receptor blockers and other drugs that might be very, very effective in terms of dealing with addiction and helping people with recovery as part of a comprehensive recovery plan. Let's put our emphasis and time on that. And I think that will, in the end, be much more successful in dealing with the problem. So I find myself in sort of this interesting position of being for criminal justice reform, being for dealing with this issue in a different way, getting away from the classic war on drugs toward, again, what I think is a more effective, constructive, conservative approach to it, but not thinking that legalization in and of itself is going to be helpful to reducing the number of people who fall into drug addiction and despair.
Do we have time for two more, Senator? Robert, and then Alex Broll.
Thank you for your remarks, Senator. Former Governor Romney recently came out and said he would support indexing the minimum wage to inflation. I'm just curious about your broad perspective on the future of the minimum wage debate, and where is there room for Republican discussion, if any, on that issue of the federal minimum wage?
Yeah, you and I have talked this a little, Bob, but my concern about the proposal that I've got to deal with, which is $10.10 an hour and not indexing to inflation, is that I think it's going to result in lost jobs. And that's not my analysis alone. It's, of course, the analysis of most economists who've looked at it. There's one analysis out there of 100 economists and looking at it, you know, from different perspectives, and 80 of them come out with this same result that the Congressional Budget Office ended up with, which is this is going to result in lost jobs. So in terms of dealing with poverty, I don't think it's effective. I think it, in fact, is counterproductive because so many people don't even get on that first rung of the ladder. without having the opportunity to get a minimum wage job. By the way, it's about 2.5% of our workforce. 50% of those people minimum wage, as you know, are between the ages of 16 and 24. So it's a very young group that gets paid minimum wage. In terms of poverty of that small group of the workforce, we're told that roughly 20%, maybe less, of those folks would fall under the poverty line. So it's not primarily a poverty program right now. It's a program that is important. I think you should have a minimum wage. I actually support indexing it to inflation. I'm fine with that, as we do in Ohio. Ohio, our minimum wage is $7.95, so we're about 10% above the national average, and we've chosen to index it. I think states should have that opportunity and option, and I wouldn't want the federal government telling Ohio that we can't index it to inflation. The advantage to that is you don't have this stair step that you have now, where every 5 or 10 years there's this great political discussion about minimum wage, and you create a cliff for those folks who would otherwise benefit from it, because employers are not going to be able to go from $7.25 to $10.10, and they're going to figure ways to do with fewer people or not hire somebody who would have had that opportunity to get on that first rung of the economic ladder. So I was one of those who voted no for the 10.10. I do support Ohio's minimum wage, which is $7.95 indexed to inflation. Sort of takes the politics out of it too, to be honest with you, which I think we should be focusing more on some of these other issues that deal with poverty. Arthur's done some interesting work in this area, as have others, on how do you come up with a system that makes more sense to encourage work. The EITC is, of course, one way to do that. I've been a big fan of the Work Opportunity Tax Credit. In fact, I was helpful to amending it in committee, and I'm going to be hoping to do that on the floor to broaden it so you could include long-term unemployed, because it gets people to work. So it subsidizes work, essentially, rather than the minimum wage. I think there's some better approaches to it.
Alex Brill.
Thank you.
Alex?
How are you? You just started to talk about the tax code, and I wanted to follow up on that question, switch the other side of the ledger. What's the role of the tax code in fighting poverty? Is the tax system, the earned income tax credit, and other policies, are they working? Are they the most effective? And as we think about tax reform more broadly, should we be putting more emphasis in tax reform on the poverty question versus other issues like tax simplification and things like that?
Yeah, thanks, Alex. That's a really interesting and difficult question. I thought you were my friend. Look, I have really mixed views on this, because I don't think EITC is particularly effective through the tax code and through the IRS. Why? Because the IRS spends all of its time trying to figure out, why we are reporting less income than we should be, because we're trying to, avoid our taxes. That's what they're good at. I mean, if they're good at anything, that's what they do, right? And for EITC, it's often, of course, just the reverse. They're often having to prove that somebody is reporting too much income, because you have to get income in order to get EITC. And they don't police it. They don't enforce it, because they don't have the resources to do it. And that's why it's believed that there are, probably a 20% mispayment rate. Some say 25% now. 25% mispayment rate. So in other programs that are considered poverty programs, along the lines Josh was talking about, there's maybe, a 3% error rate. Whereas in the ATC, it's over the last decade, probably, I'm told, $120 billion was misspent. So it's not a very effective, you can't say it's an effective program from an administration point of view. The IRS probably is not the right body to be enforcing that kind of a poverty reduction program or a work incentive program. And that's my concern about it. On the other hand, I do think that properly implemented, it encourages work, and that's a positive. So I've had some proposals out there. One is to say, let's have an offset for taxes, so that at the workplace, for instance, you would have an offset not just for your income taxes, but for your payroll taxes, which would take most of these folks into the tax code in a way that is easily enforced. Puts a little more pressure on the employer, but in employers I've talked to, that's not a huge burden, because they're determining anyway how much to take out of paychecks for purposes of payroll taxes. And they would just take out less for payroll taxes depending on what someone's income was, reported to the IRS. So there's a way to implement that. I think that is more effective from an administration point of view. And that's what I've been looking at, is how do you make EITC work better so you don't have these huge mispayments. By the way, when my constituents find out about that, as we talk about, I had a teletown hall meeting last week, and they're shocked that you have those kinds of huge levels of mispayment. And they want to know, why aren't we doing something about it? Well, one way is to bring it back into the system of payroll tax deduction, in effect. The one thing I will say in addition to that is that there are some people who get EITC now who use it to offset their income taxes and their payroll taxes, and beyond that they still get a transfer payment. So there you would need to come up with, to have an equal program, some kind of more creative way to do it. I talked about the work opportunity tax credit. There's some other work subsidy ideas that Arthur and others have worked on. So there are other ways to deal with that. But I do think as part of tax reform, because it's about how to create a more pro-growth, efficient tax code, I think on the efficiency side you have to take a look at that and determine, is there a better way to ensure that those funds are going to the people who really need it and deserve it.
On behalf of all of us at AEI, Senator, thank you for fighting for the poor. Thank you for coming here today.
Arthur.